Mental free health check-in. Anxiety can sneak up on us when we least expect it.
This is really to help our kids, but Scott and I do consider this free therapy every week.
Free therapy every week.
So welcome to free therapy. As parents, there are 5 things we might be doing without even realizing that really create anxiety for our children.
Yeah.
Here now to help us identify this, change our habits, Dr. Laura Saunders, a child psychologist at the Institute of Living. Welcome. Hi, Dr. Laura.
Hello, friends, and happy Wednesday.
We love your new set. It's beautiful.
Yeah, you're like, where?
Thank you. They're trying to upgrade my style.
I love it.
You're very fancy. You look
very
great.
fancy. Can we afford you now?
Are you still free?
I'm still free. I'm still free and here for all of you.
Thank you. All right, so I totally get this. And I know I must do this, but let's talk about, like, sometimes we are, I guess, projecting or we're doing something and, like, we're feeling anxious, maybe that they're not getting their homework done or they're not getting out the door, and all of a sudden you see their behavior go from bad to worse. Like, is that our fault? We're making them more anxious?
Yeah, so there's actually, anxiety is fairly common, right? We're talking about like 20% of children worldwide have some measure of anxiety. And there's things that we can do as parents that will worsen it or perhaps lessen it or make it better. So why not engage in some behaviors that could actually lessen the amount of anxiety that's sort of floating around out there? So one of the things is avoiding it. Right? Allowing our children just to avoid anything that causes anxiety really can be detrimental. So one of the big things where you see avoidance is at school, right? Kids don't want to go to school. They have a stomach ache. They have a headache. Their arm hurts. Their ear hurts. There's all sorts of things. And these are real physical pains. I'm not even saying that they don't feel that way. But when your child comes in every day saying, I have a stomach ache before school, what you get to say is, I hear you have a stomach ache. I'm sure it's uncomfortable. However, let's get you to, it's not because of the flu, it's not because of COVID, it's not because of these other things. Let's get you to school, get 2 hours into the day. If you're still not feeling well, go and see the nurse, right? Get them in, get them to not avoid whatever it is they're avoiding. Very often, once they get into the routine, they'll be okay, but doesn't mean the next morning they might not say, I have a stomach ache, I don't think I can go to school. I know you don't have this. I know you don't have that. I know it's uncomfortable, right? You're validating, but step into it.
Yep, so don't avoid it. And that's so important to even understand that sometimes there are physical symptoms of anxiety. So number 2, you say don't shy away from conversations about feelings, which is maybe how we were raised, but we really want to be more talking about feelings, especially uncomfortable ones.
Right. The old expression is suffer in silence, but we really don't do that anymore, right? We don't encourage that. So let's have discussions on these things. It's okay to talk about how you feel. I feel worried about this, or I feel upset when this happens, right? You're modeling for your kids, which is also one of our points here. But we're talking openly about these things as a way to show that it's okay to talk about feelings.
Okay. Yeah, so they say that that's part of, it can actually help anxiety because your kids don't have the vocabulary, right? So we're telling them, you sound like you're feeling upset, or you sound like you're feeling rejected, or you sound like you're feeling down. Like then we help them by actually naming the feeling.
Exactly.
Right, we validate.
All right, being overly cautious.
This is a big one.
So I've heard the adage that when kids go to a playground, and this is very gendered, but when kids go to a playground, moms say, be careful, and dads say, have a good time and play hard, right? And so, yes, we want our children to be somewhat cautious or have the skills to understand, but if you don't try anything, if you don't push yourself, you don't learn anything. So I'm not saying we can't be somewhat cautious, but let's not get catastrophic. Every time you go to the playground, you seem to break something, right? So that's kind of catastrophic, and that's sending the message that I can't take any physical risks. So just being aware that you're not trying to be catastrophic, so it's using skills. So when you go to the playground, make sure you use both hands when you jump off the monkey bars, right? So things like that, give information, but don't be too overly cautious.
Okay.
Okay. This is a big one, refusing to cope with our own anxiety.
So this is a big one, and I think it's something that's really important. If we don't acknowledge that we ourselves have anxiety. We all get anxiety at different points. Some of us carry a lot more anxiety than others. But if we don't acknowledge that we have anxiety and we, what I call, project it onto our children, right? We take our anxiety and we constantly put it on them, then that just fuels their inner anxiety bucket. So the more we can manage our own anxiety, like, okay, that's mine to worry about, or that's my issue. The more we can do that, the easier it is to not put anxiety onto our children or not worsen their own anxiety.
We only have 30 seconds. Sending mixed messages.
You can't say to your child, you know, do good in school, but no, have fun too, right? So just be clear in your messaging. Validate their feelings when they need it, and it's okay to talk about and identify emotions. We are role models and we try to teach them.
All right. Are you standing up or sitting down? I'm just curious.
I'm standing.
Oh, you look very good.
Thank you.
Okay. Have a great day.
We're going to get into some deeper therapy on this. We'll have a longer session on Kara's Cures, so I hope people can join us, and you can download the episode, listen in your car, listen to it with your kids or your spouse. So thank you, Dr. Saunders. We'll see you in a little bit.
Have a great day.
All right, you too.
All right, still to come.